Welcome back to the University of Nebraska President's Halftime Show with President Jeff Gold, where we catch up each and every week and talk about what's happening across the university. President Gold, what's on your mind today?
Well, interested to talk today about health and healthcare. So, of course, that is directly related to all of our athletic programs because we know that nutrition and training are critically important to athlete performance, which directly connects to the win-loss ratio, of course. And I know that all of our coaches, our athletic directors, and others are laser focused on the health of our athletes. But the university is also focused on the health of our state and to be a leader and exemplar for the rest of the country.
You know, the last time we talked, you briefly mentioned the Douglas Christensen Health Science Education Complex. Many new physicians will be trained there with the addition of a medical school out in Kearney. Can you talk a bit more about what this entails and what it will accomplish?
Sure. So this is not just a facility, which is a public-private partnership that's rising out of the ground, and by the way, is on budget and on schedule. Will be completed in late fall, early winter of next year. But this will be the largest health science interprofessional, interdisciplinary center of its type in the country. When it's completed, fully staffed and fully enrolled, which I'm expecting will be in just about a year or so more, we'll have over 640 students, future physicians, nurses, pharmacists, dentists, many allied health professions who will be receiving their education and their clinical experience in rural parts of our state. And that is a really important factor in predicting the future health professions workforce and therefore the future health of our state.
Very important stuff. President Gold, as you know, October is National Breast Cancer Month, which creates a lot of awareness around a cancer many women experience. I know cancer is one of Nebraska's pressing problems. Can you talk more about the work the university is doing to help combat this disease?
So, as you know, Matt, in our state, Nebraska is a very, very pressing problem. The role of breast cancer, the role of lung cancer, colon cancer, pancreas cancer, so many others, has actually exceeded the death rates from heart disease. And we're one of the very few states where that is the case. Maybe we just do a better job of diagnosing and treating heart disease. But like any disease, but particularly in cancer, early diagnosis is absolutely key to not just management of the disease, but complete cure. You know, when I was a medical student, 85% of all children's cancers were fatal within 6 to 12 months. And now it's just the other way around. It's less than 10%. And that's because of better and earlier diagnosis, more effective treatment. We have very effective screening techniques. You know, the sine qua non for identifying early breast cancer is self-examination and mammography. When we find small, isolated lesions, these can be treated, and in many, many, many instances with our new treatments can be cured. So that's the message. And one of the reasons breast cancer is such a challenge and such a problem in the state of Nebraska is particularly in rural communities where mammography may not be that available. It may take hours of windshield time. Women are just not taking the time to do it. And when the diagnosis is made later, the results are more significantly bad.
Let's talk a little bit more about cancer treatment and care. It's not the only way the University of Nebraska is helping make our state healthier. Tell us more about other healthcare-related initiatives going on across the university.
Well, we're very interested, of course, in heart health, cardiovascular, as we call it, and as a long-time healthcare professional in the operating room and in the clinic dealing with heart disease, it's near and dear to my heart, as you might say. And that, again, has to do with lifestyle determinations. It has to do with exercise and diet. It has a lot to do with tobacco as well. And we know that if people are careful about maintaining their lipids in their diet, making sure that they're being tracked, and now that there are very, very good statin medications to help control lipids, people get some routine exercise and take care of themselves, you can really reduce the significance of heart disease and the number of heart attacks and strokes and so many other things that truly change people's lives.
Well, President Gold, before we wrap the show up, anything else you want to share with the fans?
Sure. While we're on the healthcare bent, I can just say that we've been very honored that we've been asked to help the people in Rwanda, Africa. Now, you might wonder why that's significant, and that is because there's recently been a so-called controlled, unquote, as we're told, outbreak of Marburg virus disease. Marburg virus is one of those highly fatal hemorrhagic fevers, very similar to Ebola virus disease that we read about back in 2014. And while the number of cases are limited, they have asked for our help, and we've deployed a team of health professionals to Rwanda to help these people out. Again, it's just another example of how the University of Nebraska has a global reach and a global impact.
Great stuff. I've enjoyed these visits, and we'll do it again very, very soon. President Jeff Gold, thank you very much.
My pleasure. Let's get back to the game.
All right, let's get back to the game. We're at the half in Bloomington. The Huskers and the Hoosiers. I'll have more halftime for you in just a moment.